Hello everyone, this is Loveleen Gupta from Hyderabad. We want to talk about that very specific topic called coronavirus current therapy and alternative. We all having the same problem that coronavirus infection globally worldwide, and everybody is locked down. And I thought just to have some discussions on a Facebook to get idea about that what is the current therapy available as well as what the alternate therapy can be for this infection. So you know that coronavirus is a pandemic problem now, and talking about that infection worldwide start from China, Wuhan, as well as uh, spread all over the world. Maximum case in US and other Europe countries, and India is also having more than 30,000 cases now. So these are the situation where the infection is spreading day by day, and as virus control, the therapy is not available. So there's a question that how we can handle this virus spread situations. So there are vaccines being tried. There are several vaccines in the development phase. WHO has reported more than I think 60 different efforts going on for vaccine development, where two vaccines from one from China, one from US has gone for clinical trial, and real will come take time. So till the vaccine is coming, it's going to take at least 1 year time. So it is the very long time to vaccine to come to have people think about that how we can control this infection with a mass immunization. But in meanwhile, that it's very important to understand that what are those therapy available, which is supposed to be a repurposed way to take it other drug for making the therapeutics for a virus control. I'll talk about that, as well as what are the other way to not to having the drug, how the we can take it and the route for taking this viral infection control. So coming to that uh, next slide, where you can just make it small. Just a minute. I want just to have some slides to describe about that this coronavirus infection and how we can think about that alternate medicine. So you know about that COVID-19 is called SARS-CoV-2. Is basically is airborne and transferred human to human. You know that about. This is a virus coming in the droplet form, very very small particle, and coming to that aerosol, and the person coming in contact within 1 or 2 meter, so getting inhaled by the individual which is healthy. And this is a T zone is known for that, like eyes, nose, and mouth, where the virus get entry. And virus after getting entry, this is a varied form of response will come to the people, where the symptom will come in the mild to severe and very high grade of severity. There, the things happen very differently. Is depending on the immune system of the person. Actually, you must have heard that asymptomatic patient, where the symptoms are not there, but virus is found in their respiratory tracts and mouth. So this is important to understand that how this virus is present, but is not showing that any symptoms. Basically, this is depending on that how good immunity the person has. Even the virus is there is not showing any symptoms. But suppose that virus is a very high amount and immune system is little compromised, where the things are getting settled down. So what will happen that it will start from that start like a fever and mild cough called dry cough. This will come start with. So that time the symptoms will be like very mild, and people get to know that okay, getting severity, people consult to the doctors, and after that. If it is much more delayed, maybe 3 to 4 days or 5 days, the coughing will be more serious and coming to the short breathing, as well as coming to the pneumonia. And sometimes it causes that shock condition, where that hypovolemic shock is happened because of cytokine storm. Must have heard the word called cytokine storm. So that cytokine storm basically is influx of viral infection so high, the body react and developing a level of cytokines very high, and that causes septicemic shock or maybe of acute respiratory shock. But is the condition not the shock conditions where things will be prevailing much more severe, where acute respiratory distress syndrome will happen called ARDS. So that ARDS basically is causing because of a lot of mucus secretion is happening, and because of this infection as well as cytokine, this causes the lung filled with the fluid, which is getting the compromised oxygen transferred in the lung. Lung is known for oxygen transfer and purifying the blood. Everybody knows about that. So if the lung is filled with that fluid, which is a mucus in nature and getting compromised, because of that, this respiratory distress happened. So you must have heard that people are going for oxygen supply as well as a ventilator because of those acute respiratory distress syndrome and this compromised oxygen transferred in the lung. Okay, so risk factor where the elderly person where immune system is little compromised, other serious condition like a diabetes and cardiovascular patient and immunocompromised patient, which is some patient which is a cancer patient and immunosuppressive drug taking patient for autoimmune disorders. These people will be on a high risk. So, but these people has to be taken care of for seeing this how we can prevent them for a viral infection so that this problem will not happen. As far as treatment is concerned, this is a viral infection. No proven treatment is available for this viruses also. So supportive care is very, very important. Just to have that lot of fluids being taken. It's been shown that okay, if you have mild infection, you take a lot of hot water. Hot water will prevent the virus propagation in your respiratory tracts and lungs, and that will help your immune system to get the time or getting the virus control. Medications are very supportive, and clinical trials are going on for other medication. I'll describe in the next few more slides. Some vaccines are likely to come in at least 1 year time in 2021, maybe last few months of this year as well, where some of that Oxford University is trying with that Serum Institute of India with getting the vaccine faster in September, October, maybe there's coming the news. But this vaccine is going to take time to when they scale up and giving to the mass population. There's at least 1 year time. So that question comes that during that time, how we can prevent this viral infection, which is already there in society, everywhere, in every city, in a very different labels, where a red zone and orange zone and green zone has been described by the government day by day, seeing that the infection level increasing. As a person, we have to see that how we can prevent, and has been given to that notification from the government as well as every social media and our news media is saying about that. Go for hand washing and avoid travels. Of course, everything lockdown here, but whatever the travels in the city should be avoided. And in different outbreak area where red zones are there, government is controlling the outbreak area to not to go, and crowded place should be avoided. And very important thing is that avoid touching T zone, because that I describe about that eyes, nose, and mouth, their virus get entry. So if you avoid touching this area, cell chances of infection going to the body is very less. And if the person is healthcare worker like nurses and doctors, they have a PPE, personal protection equipment, they take it to avoid their infections. So the question comes that what is the therapy available? There are only, I told you, like a supportive therapy, the fluid therapy, oxygen and ventilator supports are there, and vaccine not available. But somehow this anti-malaria drug has been proposed as a treatment for this uh, coronavirus infection. What is chloroquine? Chloroquine and hydroxychloroquine are derivatives, and that is being proposed. It started coming the news from the US that Trump is saying that we should go for hydroxychloroquine, and India is number one producer by hydroxychloroquine and giving that treatment to a different country as well as in India. But there are the pros and cons for this therapy as well. So maybe very selectively we have to take where the things are can be taken for a hydroxychloroquine therapy, not for everybody. But Coming to that other thing, other than chloroquine, hydroxychloroquine, there are several class of the drug has been tried for a clinical trial nowadays. So I'll go one by one in a short. I don't want to go much more deeper in the science as a public forum, but I'll describe the classes of the drug where people are thinking about that. I'll tell about that hydroxychloroquine, where the first came in the line that this drug can be used for the virus control. Second came remdesivir, which is actually the drug from Gilead, is made for SARS and MERS. Has been clinical trial is being done. Meanwhile, this COVID-19 came, though with it thought of that can be used. So the clinical trial is started. Result will take time to come. Similarly, that other HIV drug like Eluvia, islopanavir and ritonavir, all are different drugs has been in the clinics. They're trying for see that how we can be actually inhibiting that infection of COVID-19. There is one drug basically is coming very highlight now called aronafin. Actually, this is virus replication stops as well as inflammation inhibitor. Means I told you about cytokine storms, where a lot of inflammatory cytokines develop that causes the problem. This drug recently has been discussed by Dr. Mahesh Kumar in Jaipur area, and they're saying that this drug is controlling the infection within 48 to 72 hours. But they have applied for a clinical trial, and the FDA has given approval for clinical trial. They are undergoing the clinical trial for this drug also. And other cytokine inhibitor-based drug called interleukin 6 receptor blocker, which is basically a rheumatic arthritis medicine. So a lot of trial is being done for a different virus, parasite, as well as rheumatic arthritis medicine. So the question comes that are we taking the right approach for controlling viral infection, or we're trying under stress these drugs, and what will be the side effects of these drugs will be, and how we can combat with the situation without any side effect, maybe of a little bit of side effect, but it's not giving that other problems start to come. The question comes about chloroquine and hydroxychloroquine. What is the benefit and what is the risk of these drugs? So according to that specific questions has been explored in different countries, and it's a mixed reaction. Some are saying that okay, this is a very good fantastic drug, is controlling the viral infection. Some are saying this is the problem happening to the heart, because this chloroquine hydroxychloroquine is toxic to the heart, and actually scientific saying QT prolongation happen to the patient. Wherever the cardiac patients are there, much more complication will happen, and that causes that cardiac toxicity. So very precisely, this drug has to be taken very carefully, whether the history of cardiac patient and diabetes, all these should not be there, so that an old age where that sensitivity of the drug will be more should not be tried that way. So the question comes that can we think about that how this drug is behaving in the world? So COVID-19, US FDA has warned against the side effects of hydroxychloroquine already, and India ICMR is saying that okay, it should be taken very cautiously, where the things are should not be toxic, should not be taken a patient which is immunocompromised as well as for a cardiac patient. But let's see that what are the side effects are coming up from chloroquine hydroxychloroquine. The majorly the side effects are common side effect like headache, dizziness, and diarrhea, stomach cramps, and vomiting. These are a mild side effect which can be managed. But in case of the old patient and immunocompromised and diabetes patient, these conditions are getting more serious, like heart disease, including heart failure issues, and causing the problem, the heart rhythm, tachycardia, and some other bronchospasm, hypoglycemia, and diabetes case, muscle weakness, and other blood vision, mental health effect is coming in the long therapy. But side effects and benefits, the doctor has to manage very effectively, so that can be taken that how we can think about that using the drug judiciously without any problem. The question comes that now that really chloroquine, hydroxychloroquine is the right treatment, or can be given to the large population or not, as seeing that side effects are coming up day by day. So the question is later will be described in a way that let's see that how we can see about how the mechanism of actions are there. So just I want to show that little pictorial form that how virus in affecting the cells and multiplying the cells where virus get entry in the lung area and tracheal area. So this is a virus as having the spike protein. They bind to that receptor called ACE2 receptor on the epithelial cells of the lung or your throat and other area. And through the receptor, virus go inside, and after that, inside that fuse with the lysosome, and after that is getting released, and then virus multiplied by using its own enzyme called RNA-dependent RNA polymerase. So, what is the hydroxychloroquine does? Hydroxychloroquine actually is a zinc ionophore. Zinc ionophore means increasing the zinc concentration in the cells by using this hydroxychloroquine. As well as hydroxychloroquine blocks, it's modified the ACE2 receptor and that virus cannot go inside. These are the two mechanisms has been proposed for hydroxychloroquine. And after zinc inside going, the zinc is basically is causing that inhibition of RNA-dependent RNA polymerase of viral enzyme. And because of this enzyme blocking by the zinc, virus cannot multiply its own RNA and virus cannot multiply, making the more copy number is not possible. Another drug we discussed earlier called Remdesivir basically is RNA-dependent RNA polymerase inhibitor. Again, this enzyme. So these drugs are targeting the same enzyme by zinc as well as directly to that enzyme. So these are the key enzymes for virus multiplication getting inhibited by hydroxychloroquine and remdesivir. So this mechanism, after getting the known, I tried to find it out that any other way we can go for multiplication inhibition of the virus. I found that I very commonly found that green tea, where EGCG is the one compound present in the green tea, is a very strong antioxidant. This EGCG binds to that virus on the surface. They are not modifying to the ACE2 receptor. They are binding to the virus and not allowing virus to bind to the receptor and go inside. That means the virus is getting targeted, not the cells, for those modification of that cells. That might be the reason that they might not be toxic as compared to hydroxychloroquine. The virus is not getting inside and that whole process will not be there. But few viruses can go inside, suppose. Then EGCG and one compound called quercetin is found that in a lot of fruits and grapes and all different I'll describe about those source of these herbal compound. These two compounds are very good known for a zinc ionophore, just like hydroxychloroquine. The question comes that how effective it is. The EGCG and quercetin are the two compounds which is causing the zinc concentration high because of zinc ionophore activity and inhibiting the RNA-dependent RNA polymerase. So another compound coming called silymarin, which is found that very good antioxidant for a liver stimulation and liver specific. This specific silymarin antioxidant compound is directly inhibiting RNA-dependent RNA polymerase like remdesivir. So there are alternate things are available, which is just doing the same mechanism where EGCG, quercetin like hydroxychloroquine and silymarin like remdesivir is there. So the question comes that can we take this as a alternate medicine which is coming from our different herbs, and think about that having the different alternate medicine for which is not taking any toxic drug. These are herbal and safe very effectively, and after that is giving very efficacy. So we have done a small experiment, not COVID-19, but is other RNA virus in the lab, and found that these compounds are fantastic inhibiting the virus replication, and that our fantastic data is saying this alternate medicine is a very good effort where we can talk about that as a alternate for virus control. Coming to that, these compound we call green tea, Epigallocatechin, gallate called EGCG, and grape seed having that quercetin. What are those chemical in nature? Basically, these are polyphenols. I think a lot of people know about that polyphenols are present in several plants, and which is providing that very good immunity to the body as well as antiviral property. So these are the compound are actually polyphenol in nature, and that makes sense that can we think about other polyphenols which can be antiviral. So our efforts gone through that, see that really other polyphenols are working that way or not. So I thought just to explore other polyphenols also other than EGCG and quercetin. So I got in literature, I found that yeah, these are so many other polyphenols are known, which is controlling the virus. Especially if you go for a gallic acid, is present that in some of the plant called Arjuna, a very high amount, as well as some of that plants, the fruits I'll describe in the slide, where can control H1N1 infection. And foodborne different type of polyphenols can be used for coronavirus has been discussed in one of the paper. Hepatitis C again is the RNA virus, which is natural compound can control, all polyphenol can control. Quercetin is a very common promising treatment for a common cold as well. So these are the promising drugs, and antiviral compound like silimarin basically is coming in the literature as well as saying that this is a very good compound, can be used for antiviral property. Silibin is a modified, like little other version of the silimarin called silibin, which is also known for controlling hepatitis C. All are RNA virus like COVID-19. These are known and they are working either of RNA-dependent RNA polymerase inhibitor or zinc ionophore. These are the actually polyphenols doing miracle, and that is not explored properly and is reported, but this not been seen in the place where we can control this COVID-19 using the polyphenols. Okay, so coming that what are the source? It will be amazing to know that this they are vegetables and fruits. There are different polyphenols are known for antiviral property called camerol, luteolin, naringenin, oleuropein, catechin, apigenin, sanidine, gallic acid, and lactic acid. So camphorol present in the all melons like watermelons and muscadines, all these are present. Luteolin is present in that capsicum guy and just brinjal or different type of spinach. And coming to that, your catechins are present in like your kiwi and your cherry and tomato. Tomato is having a lot of epigenins. Sanidins are dark color like grapes and other berries are present that. I mean to say that these are the fruits and like apricot. These are the fruits are there and vegetables are there having a lot of polyphenols. And if you take these polyphenols in a proper way, and but the amounts is very low. I mean to say that they have to take a lot of amount to get that proper getting antiviral property in our body. So of course, you take the green vegetables and fruits, then chance is very high that your polyphenols will prevent you for a viral infection. Now, coming that really we are taking it, but why it is not so effective? Because we normally have a habit of cook this food, but fruits are okay, but vegetables are cooked, and that is getting nature. So if you take that green vegetables as well as the fresh fruits, that will help for controlling this viral spread infections. And second part is coming that can we think about that how we boost our immunity? It's always being discussed that can we boost our immunity to control the viral infection? So there are several plants are there which is actually and fruits and plants are there which is providing that immunity boost. which is are different than polyphenols. There are some polyphenols which is giving the immunity booster as well, but other our spices and herbs provide that immunity, which will give you the better scenario where we can control the infections and make our immune system strong, that virus cannot multiply and cannot spread in our body. These are different than polyphenols. We're talking about that polyphenols inhibit the virus multiplication directly, but other natural herbs and spices will help the body to make stronger so that the virus infection cannot cause any problem. So these are the two different concepts we're talking about: boosting immunity, that making our body stronger and can control any viral and bacterial infection, not only this COVID-19, but this giving that immunity to the body. So what are the herbs are there? So very commonly found in our kitchen and different forms of the spices: clove, ginger, cinnamon, and turmeric. And these are actually is known for boosting immunity. And like a lemon, yes, take the honey lemon is always known for immunity, boosting immunity. Oregano, arjuna, mint, and taking that vapor from the mint as well as eucalyptus oil will and the leaves of the eucalyptus, giving it a soothing effect to the lung as well as trachea. So that will give the soothing effect. But I want to say that there are mix of the two things. One is the boosting immunity. Something there when infection come and there's some problem of the respiratory symptoms are there, how we can cope up with this. So there are clove, ginger, cinnamon, turmeric, and your these are actually are immune boosting, but some are like a licorice. Licorice is gallate and it's called mulethi in Hindi, I think. So that licorice as well as arjuna and oregano, that will help you in then the complications of happening about this problem. So they can be combated with this. Like lung, a lot of mucus secretions there, short throat problem there. This can be controlled by the mint and eucalyptus and cinnamon and licorice. But immune system booster as well as for the controlling that your lung symptom or coughing symptom, all we can use by oral from the herbs. This is, everybody knows about that in India. People go for a kadha using ginger, cinnamon, clove, turmeric, and this is being in practice. So need to explain much more that, because we Indians are known better than we go for a kadha therapy, and when we have the any infections coming to us, any sore throat and all this thing problem. So these are very effective. So any small symptom coming from, no matter how COVID-19 or coronavirus or something else virus infections are there, these are being in practice. So this is very, very effective. I want to say that. So coming in the practice, coming to make our immune system stronger, which is required to have in our uh, like food habits, or some of the morning and evening can be taken as a kadha type things, help us in controlling viral spread in our body if it is coming, something like that. So there are several vitamins and minerals are there also, which can I want to describe about that, which is very good for immune boosting. First thing, vitamin B6, vitamin C, like all citrus fruit, oranges. Vitamin D is coming from the sun, but supplementation to be taken because nobody goes so much amount of time for the sun. That's the reason the vitamin D should be as a supplement. And two different minerals. I talk about a zinc. Zinc not only for antiviral property called zinc ionophore, but is zinc as an immune booster as well as one more minerals called selenium. These two minerals are actually immune boosting. So thinking about that, vitamins like the B6, vitamin D, and vitamin C, as well as taking the zinc and selenium, that will help to immune system getting stronger. So these are the vitamin minerals, but other herbs as well as polyphenols, we discuss about that for controlling the situation of the viral infections. So I want to say that we should eat healthy, stay fit. We have to make a practice that we take that good amount of vegetables and fruits, as well as taking the supplement. These are the food supplements. don't think about that is a medicine. Food supplement taken as a part of the food, like vitamins, minerals, and vegetables and fruits and different type of herbs and different spices. I talk about that. If it is coming in the practice in our food habits from morning to evening, with a very remote chances the infection will come. Otherwise, it will not come at all. So, coming in the picture that how it is possible that what are the way that we can take it. It's not possible to take that these so many of the fruits and vegetables every day, and continuity will not be there. So now the things are coming in a supplement form, coming like a zinc supplement, as well as for the polyphenols supplement, as well as for like spices base, and as well as other immune booster supplements are coming. Should taken there regularly, especially nowadays where the chances of infections are high, those should be taken on a regular basis. And India is known for a Chyawanprash, so this is a very good to take the Chyawanprash at least 1 spoon every day, will boost our immunity and will not allow the virus to come and to settle down infections. And this is not for a COVID-19, this is for other full influenza and for other coronavirus infection will come, will not be coming to that. So this awareness will be making our practice to take that in the food that will surely will help us to making our own system stronger. But of course, as a human being, we should be safe, should not be exposed so that for the infections. I want to say that stay home is this is beneficial to everybody. Stay home, enjoy the family time, go away, watch TV, have that thinking about that, talking each other in the home and the phone calls and social media. This is the way the time should be. I would say that be safe, be smart, and stay at home. That is the message I want to give to everybody, and that get safe from the infection. Slowly, the infection will go away, and that everybody will benefited from there, not getting exposed. But meanwhile, during this time of that getting home, you should be not forgetting taking that different food, vegetables. I discussed about that, and spices, as well as taking care of yourself for the proper sanitation measures to make it everybody healthy. Thank you. Thank for attention. I think I have given a proper awareness that how our food habits as well as other herbs and vegetables can help us for controlling this infection. The time phase going on this, how can we control that infection in this time. So I want to say that with this note, um, I want to say everybody should be safe, stay at home, and follow the guideline which government is giving. And truly, this is for us. And I appreciate that health workers and other police people and other people who are serving the society in this tough time, and they do the great job to support them. So I'm stopping that our presentation here, my presentation here, asking that people give the questions to the message box. I'll try to give the answer to everybody. Please ask the questions and the message, and then I'll give the answer. Thank you for your attention. I'm here to give the answer to the specific questions. I see that a lot of people are appreciating, but nice that somebody has a questions and they can about this. And this video will be available after the presentation also, and before that something. Some of the questions coming that how social distancing. Yes, of course, social distancing should be followed. Is 2 meter according to that, because why 2 meter theory? Because when somebody cough and sneeze, droplet spread over in a fast speed goes up to 1 to 2 meters. There's a guideline came that can be cover up the area of 1 to 2 meters so that virus not getting exposed to the healthy people. So the next question is coming that active natural compound and prevent endosome fusion. Actually, this is a endosome fusion happening from chloroquine, but is somehow it is toxic. But other active herbal compound polyphenols, some are there, but it's not so effective endosome fusion. So actually, fibrosome endosome fusion is a natural process, should not be avoided, because it's a process where body try to degrade the toxic material of the virus. So I think that fusion should not be inhibited, should be there and should be degrading that bacterial virus so that can be degraded properly. So one of the questions is that can we include non-veg in our diet? It doesn't matter about that veg diet. It's basically that how we can take the balanced food. Our balanced food should have that, of course, nutrition like protein, carbohydrate, minerals, and all things. But taking that all herbal thing together, that will be helpful for controlling and making the immune system stronger. This doesn't matter about non-veg diet. One question coming like coronavirus RDRP very different from other vectors. Yes, they are little different on activity, but has been found that these are very generic inhibitors. Really, polyphenols are binding to the protein very differently, not to the pocket of where enzyme is activity. So binding to the protein and not allowing that RNA to come to this getting multiplication by this enzyme. These are not a pocket inhibitor. It's not like a classical enzyme inhibitor. Basically, is stopping that RNA to come into the contact with the enzyme. One question coming that herd immunity is a viable solution. Yes, this is a solution where people are waiting for that for vaccination, but they can take time. And one of the country called Sweden is taking the measure of going for herd immunity. They're saying that is controlling that your curve is going down, and after that they're getting infected. So herd immunity is the option, but we have to take care of that old people and diabetes and other immunocompromised people, like where therapy is going on for a cancer patient and auto disorder where immunocompromised thing happen. So these herd immunity, when you go for that, it's a little risk on those people, especially where old age and immunocompromised people. So we have to be very judiciously using that. This is the two ways what can give that herd immunity faster with natural infection, but the problem of old infection, old people are on the risk. So very judiciously taken. Another question is coming that can you further elaborate EGCG? Actually, EGCG is a catechin present in the green tea, and we take every day. But amount of the EGCG present like a 1 cup is providing very very less amount, and I would not recommend go for at least 12 to 14 cups. You take that for your tea, green tea, to have that dose for antiviral. So I would suggest that to take that supplement which is having that enriched EGCG and other polyphenols which help for antiviral infection. Somebody is saying that WHO has mentioned the incubation period from 1 to 14 days. So how far the contact tracing is effective? This is a varied form, because I told in the initial discussion about if the person is immunity is strong, this person can be asymptomatic. Virus is there, and the virus can multiply their respiratory tract, but they are not showing any symptoms. Those person be spreading that virus for a longer time. But if that the virus going symptoms and body getting response anyway, that asymptomatic also, the body get have a time to developing immunity for antibodies like antibodies and cell-mediated immunity. At 2 weeks, that is like conventional people saying that for any virus, is control that in 2 weeks time. But if the immune system is weak, where the antibody is coming little later or not coming so effectively, those people having the virus multiplication going on, that will give the spread of the virus for a longer time. So we have to be selective. If the person immunocompromised, the chances are there that virus spread will be there for longer time. So contact time should be, for those people, should be longer as compared to healthy immune competence. Some question coming that garlic in the list. Yes, this is a very strong antiviral property, immune system activation antiviral property. Garlic is there, and as per the thing, but again, this coming that the garlic is having one compound called allicin, which is very sensitive for a temperature. So cooking our hot oil system for the garlic, they will destroy that active compound, and because the smell and taste is little difficult to have the garlic for to take that, and this is so smelly. So this presentation is applied to all groups. Yes, this applied for all groups. This is for a child to old age. This supplement and green vegetables and fruits can. Some question is coming that is there a polyphenols as therapeutics? I would not recommend as a therapeutics because polyphenols required is a lesser activity in as for a chloroquine hydroxychloroquine, but they are effective. In our experiments, found that effective up to that like 1 to 2 microgram per ml in our cell culture experiment, but I'm not sure about that in the body. We have done a very preliminary experiment, found that the antiviral property getting absorbed in the blood and showing that antiviral property when do experiment in vitro. The question come that yoga like pranayam also is a good immune booster. Yes, yoga is taken properly and it boosts the immune system, but it's regular feature. At least half an hour yoga should be there to make that our immune system stronger. But different type of yogas are there to stimulating the immune system. And that question is coming that zinc and selenium is diet will help. Yes, zinc and selenium will help in the immune system to boost, as well as zinc as a antiviral property will help to control that low level of viral infection. The chances of viral infection will be reduced. And virulent viral strains that can be used as a vaccine. Of course, any attenuated vaccine, if it is avirulent, this can be used as a vaccine. But COVID-19 is not being known yet. This can be tried, but few companies in US is trying for a M2 deletion. That means cannot multiply, but they are infective. So these type of viral is being made is not called as attenuated virus, but is avirulent. We cannot multiply in the cells, but they infect the cells. The immune system will be active against that, but they cannot multiply. So this type of approach being under trial, and these are the questions I think I have tried to give the answer. Of course, one last question is coming like the external weather has some impact on transmission of virus. As far as external weather is concerned, our immune system is varied. The winter season is little compromised, and lot heat and sweltering, the immune system is getting compromised. That time, virus getting chance to settle in our body. Because of that, not because of the virus is stable and not stable in the cold and hot weather. Our immune system is varied in a different stress conditions. That time, infection will be there. One of the questions coming plasma. Yeah, this has been started in India. This started in China for this virus infection, as well in the US. Trial is done. So what is there that taking the plasma of that recovered patient is then his immune system is good and that antibody is present in the blood. So if the blood is taken, separate the plasma and given to the infected patient, it has been found that infection goes down drastically, and causes that virus control very effectively. This is effective treatment, but again, it has to be seen that what is the actual antibody titer present in the plasma or the blood that can be given. So very important to understand that it really is a good and that can be given for this control. Yes, this is the very good therapy, but the recovered patient to know that which is not having other complications, other infections, and other that can be used for this.